Awesome. Thanks for being here, everyone. I'll just give it one more minute and then we'll get started. Awesome. Alrighty, I'm going to go ahead and get started. Thank you all again for joining us on a Friday. I appreciate you taking the time out of your day to hear. We're really excited to have Allen Mattison with us today to talk a little bit about what type of advocacy we can do and those distinguishing lines between advocacy and lobbying. So we are recording today's session. We will be sharing the recording out with folks who weren't able to join us today. We will also probably share it or upload it on APHA's YouTube channel in order to share it more effectively that way. I did want to make a few administrative reminders before we get started. One is that we are going to have a session at the annual meeting, at APHA's annual meeting, that'll be in November in Atlanta on this very topic. So the session will be hosted by the APHA Government Affairs team and Change Lab Solutions. And they'll—
I'm looking for documentation, but let me send you what I have.
Sorry. We'll be talking in detail about the lobbying versus advocacy restrictions and rules. So definitely check that out if you will be in attendance in Atlanta in November. So a little bit about why we're here today. APHA is funded by the Robert Wood Johnson Foundation on a project to focused on public health authority, specifically supporting advocacy efforts to protect public health protections. And I will post a link in the chat for you all to take a look at some resources we've compiled as a part of this work. Just asking folks who aren't to mute. Sorry, I'm getting a lot of feedback trying to mute people as I see them, but definitely if you're not speaking, please mute. Oops. Okay. Alrighty, so resource link in the chat with some resources that we've compiled as a part of this project for advocacy. Without further ado, I'm going to introduce our speaker for today, and then I will turn it over to Allen himself. Allen Mattison is a partner at Trister Ross, specializing in helping nonprofits mitigate their legal risk so they can engage in meaningful advocacy. Allen is an expert in IRS code that governs what nonprofits can do and can't do when it comes to advocacy and lobbying. Allen received his JD from Georgetown University Law Center, and before becoming a lawyer, Allen worked in political communications, serving as the Sierra Club's National Media Relations Director, and in communications roles and campaigns in the U.S. Senate. So we're happy to have you, Allen, and I will turn it over to you. Thank you so much.
Thanks so much. I'm really glad to be here. And thank you all for joining on a Friday afternoon when I'm sure your minds are at the beach or whatever your weekend plans are. The goal today is to talk about ways that folks can get more engaged in advocacy. And I want to make this as much of a conversation as possible. The starting point of what we're going to discuss is based on questions that you all submitted. And I want to make sure that we address questions as they come up. So if there's something that I say that you might be confused about, please ask. I've got the chat box open, or just raise your hand. I guarantee that if you're confused about something that I've said, there are probably a dozen of your colleagues on the call also who are confused and who would love it if you ask the question because they're just being shy. So please ask questions. It's going to be participatory. I've got a bunch of questions for you all that I'm going to be asking as we go along. My biggest goal here is not to get people outside their comfort zone, but rather to expand people's comfort zones around the advocacy that we can do in public health. A lot of people on the call are coming at this from different places. Some folks are, their day job is at a government, city public health or state public health office, or they might be volunteering as a member of their affiliate leadership. They might be at a university, publicly or privately funded university. People are coming at this from across the spectrum of different jobs. And so they have different, or you all have different pressures that are on you for how much advocacy you can do and what are the external factors there. So we want to sort of just wrap our heads around that, recognizing that different people are coming at this from a different place. But the more that people understand about what is advocacy and how we can do it safely, the more people are going to feel comfortable with it. We can expand that comfort zone by learning about what the rules are and what are the restrictions that we're facing. And most importantly, I think the thing that really surprises people is how much we can do in terms of advocacy. How much, people get this idea that lobbying is forbidden, or I can't do X, Y, or Z. And they're thinking about it in the negative rather than thinking about the positive of how much they can do, regardless of where they're coming at it in a different context of, there's a ton that we can do to change public policy. And as we all know, given the pressures that public health is facing, the time right now is more urgent than ever that we engage in this and we don't shy away, but rather that we really embrace advocacy. So the first thing I want to talk about is who can lobby. So nonprofit organizations, whether it's APHA itself, the different affiliates, all sorts of 501c3 organizations are allowed to lobby. That's sometimes there's a misconception out there that because a person is affiliated with a nonprofit, they cannot lobby. That's not the case. We're going to talk about what are the limits and the restrictions on lobbying for 501c3s, but the bottom line is 501c3 organizations are allowed to spend their money on lobbying. Individuals are allowed to lobby, whether you're as an APHA volunteer in your volunteer capacity, whether you're trying to engage students or other audiences in the general public. Even government employees are allowed to lobby, as long as they're doing it in their personal capacity, off the clock. And that's something that people sometimes are a little bit hesitant about. If they're a government employee, they don't want their activity being attributed to the government agency that they work for. And that's the key, is that when you're off the clock and you're working on your own time. So as long as you're not using your government title, any government resources like your government email address, you're allowed to engage in lobbying. So some government agencies restrict what its employees are allowed to do in terms of advocacy or lobbying when you're on the clock in your official role. But I encourage people to recognize that when you're serving in a leadership capacity of an APHA affiliate, you're off the clock. You're not working in your government capacity by and large. And to the extent that your assignment from your government agency is to serve on the affiliate, there are ways certainly to make sure that we're demonstrating that we're not on the clock or that we're not working in the government capacity when we're doing various types of advocacy. So who sets the rules? This is an example. I work with County Health Rankings and Roadmaps, which is a project that I'm sure many of you are familiar with. Various different projects, regardless of where you are. This is a project that's operating out of the University of Wisconsin. They've got a whole bunch of different factors that are pressing on them in terms of their advocacy work. They've got the IRS rules that are, these IRS rules are coming down in the form of restrictions on grants that they get from Robert Wood Johnson Foundation or from other funders. They also have a set of restrictions that are coming from the university on them as university employees of what UW employees are allowed to do. And then the state of Wisconsin has restrictions on what state government employees can do. And so if you're working at a project like CHR&R, you need to be factoring in all of these different pressures, really. And when you think about the context of your advocacy, but that doesn't stop them from doing advocacy. They're really smart and strategic about the advocacy that they're doing, recognizing that they have all of these different factors that they've got to balance, whether it's the state, the university, or the restrictions that are coming in their foundation funding. So, it's something where you've got multiple dimensions of issues that you have to juggle, but we're all smart people, and it's not that hard to balance all these different dimensions here. So the bottom line, when you're looking at something like an APHA affiliate or another nonprofit, is that 501c3 public charities are allowed to do lobbying. There's a limit on how much lobbying, and we'll get to that in a minute. The important thing to understand here is that there's two different types of 501c3 organizations. By and large, the organizations you're affiliated with are what are called public charities, meaning they get money from a lot of different sources. The other type of 501c3 are called private foundations. They get money from just a couple of sources. Like, for example, the Bill and Melinda Gates Foundation gets money from Bill and Melinda Gates, and also from their buddy Warren Buffett throws a bunch of money into the Gates Foundation. But because they're getting money only from a few sources, there are more restrictions that the IRS applies to those organizations, one of which is a restriction that private foundations cannot pay directly for lobbying activities. And so a lot of private foundations will say, you can't use any of our grant money for lobbying. Other foundations will use other mechanisms to restrict the lobbying activity with their money. But the bottom line is, if you're getting money from foundation grants, you have to recognize what types of restrictions there are, and it probably says you can't lobby with that money. So what we're going to talk about in just a second is, well, what exactly is lobbying? Because if we can't lobby, it means we can do a ton of other stuff with that money we're getting from foundation grants. And we're going to dive in deep on all the things we can do with foundation grants that are really effective advocacy for driving policy change. And then the last thing I want to mention here is that there are other sets of definitions that apply. So Congress and your state might have a different definition of lobbying, and that's okay. There's some cognitive dissonance when you think, well, I'm in Connecticut, and Connecticut's definition of lobbying is X, and it differs from the IRS definition, and that's okay, right? So if the state's definition of lobbying where you are says that trying to influence administrative action is lobbying, the IRS definition that applies to foundation grants is different. The IRS says it's not lobbying to try to influence administrative regulations. So there could be times when you use foundation grant money to influence an administrative regulation. You might have to register and report with your state lobbying agency and said, yeah, we influenced the Department of Health regulations on whatever the issue was. But we didn't, when you tell your foundation funder, no, we didn't spend any money on lobbying. Even though you had to register and report your activity to influence the Department of Health regulations, you reported that to the state as lobbying, but you turn around and tell the IRS and tell your foundation grantors, no, we didn't do any lobbying. That can be a little bit confusing. We'll talk about some examples of that in just a minute. But even though it's a little bit confusing, it's perfectly allowable to use foundation grant money to do things that a state might consider lobbying. Any questions in the big picture about that before we dive into the specifics? Okay, well, just put them in the chat as questions arise. So one of the big questions folks have when they're at a 501c3 nonprofit is, how much lobbying am I allowed to do? I know I'm allowed to do some lobbying, but I can't do too much lobbying. How much is too much? Well, there's two different tests that organizations can use to measure their lobbying. I'm not going to get into the tests in depth, other than to say there's this thing called the 501h test, and I'll send around an email afterwards about that 501h test. the 501h test is important because it allows C3 organizations that are small to mid-size organizations. That is, organizations with less than $20 million of spending a year. If you use this 501h test, you can do a lot more lobbying as an organization. It's a really valuable thing to do to elect to use the 501h test. And not only does it let you do more lobbying, as and I'll talk about in a second how much lobbying, it allows you to do more lobbying if you use this 501h test. And also, it treats a lot more activities as non-lobbying. So when you use this 501h test, you can do a ton of advocacy activities. And if you're smart and strategic about them, you don't have to treat them as lobbying. So how much lobbying? Well, if you're really small, under $500,000 a year, you can spend 20% of your budget on lobbying. It increases on a sliding scale. So if it caps out at $1 million a year, so it's somewhere between 20% of your budget and $1 million a year that you can spend on lobbying. And I'll send around a spreadsheet so that you can calculate the exact amount of lobbying your organization can spend based on its budget projection for 2023. Any questions about this specifically before I move on? So, yeah, Christina, you have a question?
Yes. Sorry, I'm getting an echo. Hold on.
Why don't you maybe type it in the chat box? That might eliminate the echo. Or I can. So there's a question in the chat from Mary about churches. Churches are not allowed to use the 501h test to measure their lobbying. Back when the 501h test was created in 1976, churches opted out. They said, we don't want this. We think it's a free speech issue. So they said, we're not going to use the 501h test. So if you're a church specifically, you have to use what's called the no substantial part test. It's questionable about how much enforcement there really is against churches anyways. So it would be essentially churches can do essentially as much lobbying as they want, given that it's not going to be a substantial part of their activities. For faith-based organizations, I get questions a lot of the distinction between, well, churches can't use 501h. What about other faith-based organizations? And other faith-based organizations can and do frequently use the 501h test. And so if you're a faith-based organization that's not specifically a church, mosque, synagogue, a house of worship, but you're another faith-based organization, you absolutely, if your budget is less than about 20 million a year, it's probably a good idea for you to use the 501h test. And so Christina asks, basically, the numerator and the denominator of, as you're calculating this 501h test, if you're saying you can spend 20% of your time on lobbying, 20% of what? And it's 20% of the total funding. So you do count, getting to Christina's question, you do count all of your restricted funds, all of the funds essentially that you're spending on program activities count toward the 501h test. So if you're getting a ton of money from private foundations that you're not allowed to use for lobbying, that still is really helpful because it means that it inflates your denominator of how much you're spending overall, and it means you can spend all that much more on lobbying as long as you're raising that lobbying money from other sources. That's a great question. Thank you for asking that. So Donna asks, how do you make sure that it's clear that you're lobbying on your own behalf and you're not lobbying on behalf of your employer? That's pretty, people feel self-conscious about that often, but the way to deal with that is simply to assert that you're here on your own behalf. First of all, in most cases, people won't know your government role or your government title. And in the cases where they would know your government role or title, you can affirmatively say, you know, while we sometimes deal with each other through my work at the state health agency, today I'm just here on my own behalf. Today I'm here because I care about clean drinking water for my family. If you're talking about drinking water regulations or what have you, or you're saying, I'm here because of all that I've learned about communicable diseases through my background and my education in public health. And I'm here to speak on my own behalf, not on behalf of my employer. So making that affirmative statement is really all that you need to and can do to make sure that you're distancing yourself from your government role. There are, you know, as an individual, you still have your right to free speech. You don't give that up when you accept a job. There are certain people who have, you know, such prominent roles, whether you're the CDC director or perhaps the state public health director, where you do have to be very careful about that line. But in other roles within government, asserting that you are speaking on your own behalf generally will give you the protection that you need in those circumstances. So under these IRS rules, there's two different types of lobbying that we need to pay attention to. There's what's called direct lobbying and there's grassroots lobbying. And I'll send around a fact sheet. I'll send around the slides, of course, but I'll also send around a fact sheet about these definitions. The key so the definition of direct lobbying is it has to have all three elements of its definition in order for a communication to be direct lobbying. So it's communication directly with legislators or their staff about specific legislation, and it has to reflect the organization's view on that legislation. So a communication is directly with legislators or staff if they're the only ones who are going to be receiving it. So for example, emails, phone calls, letters to the legislator or staff, meetings, those are all direct communications. Sometimes an organization will buy, like I had a client buy the billboard outside of a state senator's district office that said, Senator Fernandez, vote yes on S-226 to keep our kids healthy. That's not a direct communication because even though you know Senator Fernandez and her staff will see it every time they come in and out of their district office, anyone who drove by that strip mall where the district office was located could also see the billboard. And so for a direct lobbying communication, it's really only these direct communications with the legislators or staff. It's not something like a billboard, which we'll get to as a public communication. The second element of the definition is it has to be on specific legislation. And this is really the important part that I want to drive home with folks is if you have a communication with a legislator or staff, but it's not on specific legislation, it's just not lobbying. So if you're having this communication directly with a legislator or staff member, you're not talking about specific legislation, none of that is lobbying. So you can use nonprofit, you can use C3 grant funds, restricted grant funds from a foundation, you can use to pay for the staff time for that meeting. So for example, something that's really valuable is bringing legislators in to the community to see a clinic, for example, to see and meet with people who are benefiting from the interventions that your public health department or that your organization is engaging in. And as long as you keep those based on broad policy topics and not talking about specific legislative solutions to that problem, all of that time can be paid for with non-lobbying funds. Similarly, administrative actions, executive branch regulations, rules, rulemakings, all of those things are not legislation. So if you talk with an agency head about trying to improve the rulemaking that they're doing, that's not legislation, that's not lobbying under the IRS rules. And if you talk to the Senate committee chair who oversees, who has jurisdiction over that government agency that's making the rulemaking, that's also, it's a communication with a legislator, but it's not about specific legislation. You're asking them to weigh in with the department secretary to improve those regulations. And so that's, again, not lobbying, and you can pay for your time with non-lobbying funds to get the state senator to weigh in with the department chair. And of course, the department secretary is a lot more likely to listen to the state senator than they're going to listen to you or I, because the Senate committee chair has jurisdiction over their agency. The other type of lobbying is grassroots lobbying. And this is a communication to the public. And so, Clement Chen was saying that, the direct lobbying is a private communication. Grassroots lobbying is a public communication. This is like that billboard outside of Senator Fernandez's office where anyone could see it, right? So these are TV ads, tweets, speeches to the public, newspaper ads, you name it. It's a communication to the public that reflects a view on specific legislation, and it has to include what the IRS calls a call to action. And so if you think about this definition of grassroots lobbying, if you think about it, you can have communications to the public that reflect a view on legislation, and if they don't have a call to action, they're just not lobbying under these rules. So you can pay for that billboard outside of Senator Fernandez's office. You can pay for that billboard with non-lobbying grant funds. The billboard that says Senator Fernandez, vote yes on S-226 to keep our kids healthy. So what is a call to action? A call to action most obviously is asking people to contact their legislator. And it also, because that would, we could circumvent that 6 ways to Sunday. The IRS also defines call to action as being a couple of other things that give people enough of a nudge to want to contact their legislator. Saying, Senator Representative Paulson is your representative, or providing their contact information. Those are all things, giving them a petition to deliver to the legislator. Those are all things that give people enough of a nudge to want to contact your legislator. So we have two questions here. Advocacy, so Mary asks, advocacy for a budget increases count as lobbying on legislation? That's correct, Mary. The thing I want to mention here about this key of specific legislation, right? So how specific does it need to be for it to be specific legislation? And that's something that Mary is getting at here. So if you say we need $3.6 million more in the budget for stream water testing to make sure that we've got clean drinking water, that's a specific legislative ask, because you're referring to a specific amount for a particular budget line item, right? You're saying we need $3.6 million more in the Department of Environmental Quality budget for stream water testing. So that, the budget is a bill, is a piece of legislation, and we're saying specifically what the increase should be. But if you just said we need more money for water testing, DEQ needs to be able to make sure that our water is safe to drink, that's not specific legislation, because we're not saying specifically how much, for example, what would be an adequate increase. So if you just said we need to increase the budget for stream water testing, that's not lobbying, because you're not being specific enough. So Mary, that's where you get the distinction here of how big an increase is it if you're being specific enough to address, does the legislator know exactly what we want them to introduce? And Michael mentioned there are a couple of different things that you can do to, demonstrate that you're not operating in your official capacity, not using your organization's title, your title within the organization, not communicating through your official email address, things like that. Those are all important steps that you can take to demonstrate you're doing it in your personal capacity and not in your work capacity, not in your official capacity as a government employee. And so Christine asks, in terms of a call to action, if you say contact your legislator, but don't give them specific contact information, it's still a call to action. So whether you're, if you just generically say, call your legislator and tell them to vote yes on S226, that's still a call to action because you are communicating to the public, reflecting a view on specific legislation, and including a call to action of telling them, contact your legislator. Now, a call to action does not include, for example, sign up for our affiliates email list. So you could do a communication to the public and say, AB 492 is going to really hamper the public health authority of folks of Nebraska's ability to exercise public health authority. If you care about making sure communities are safe, sign up for our email list. And that way you can collect those names, but that's not you're building your list and you're doing good grassroots organizing, but that's not a call to action under the IRS definitions, because you're not asking people to contact their legislators, you're asking them to join your email list. And so Julia mentions having a website that allows people to contact their legislator about a piece of legislation. That would count as a call to action. It's the fifth or so bullet down. If you provide a vehicle for contacting your legislator, whether that's a form email or a petition, these are all the sort of things that give people enough of a nudge to contact their legislator directly. Other questions? Those are all good questions. Thank you for asking them. Other questions about a call to action? So let's put it into practice. So here, for example, I know this is probably pretty small on your screen. Here, the American Heart Association and Sugar Free Kids Maryland wrote an op-ed. And it takes a lot of time to research and write an op-ed and pitch it to the editorial board and then work on editing it. So it's expensive in terms of staff time to write an op-ed. It's a big investment of money in terms of staff time. So here, the op-ed says the city council should pass the ban on, pass the bill that's going to ban sugary drinks from kids' meals. On Monday, the city council is going to vote on the Healthy Kids Meal Bill. This is going to be really good legislation. It's good policy. Passing this Healthy Kids Meal Bill is going to make a big difference in all of our children's futures. Why don't you vote in the chat box? Is this lobbying? And if it's lobbying, is this grassroots lobbying or direct lobbying, and why? So is it lobbying or non-lobbying? And then if it's lobbying, is it direct or grassroots? And tell me why you think so in the chat box. Donna's voting that it's not lobbying. Doesn't explain why. Walter says it's not lobbying because we don't have a bill number listed. Okay. And Marjorie says it's lobbying because we're specifying that exactly which bill it is. Morgan says it's not lobbying. Morgan, do you want to come off of mute and explain what your thinking is here?
Yeah, I was thinking it's not lobbying, just because the example we talked about earlier, where the call to action was sign up for a newsletter, that wasn't inviting someone to do lobbying. And so this is just saying very generically, this is important, we need to pass it, but it isn't attaching a lobbying type of call to action to that. That was my thinking.
Yeah, that's exactly right. It's exactly right. It refers to, it's a public communication. It's in the Baltimore Sun, so it's a public communication. It does refer to specific legislation. It doesn't do so with the bill number, but it does so by name. It says the city's Healthy Kids Meal Bill. So you don't need to have a bill number if you're referring to the bill specifically, either by name or in a manner that's so clear that it's unmistakable. But as Morgan mentions, there's no call to action. It says the city council should pass the bill, but it doesn't say contact your city council member, because no one's going to actually contact their city council member just because it says so in the Baltimore Sun, right? Like, they're not going to generate actual calls based on that. But what did the American Heart Association and Sugar Free Kids Maryland do next? Well, as soon as the op-ed was published, they blasted it out to all of their lists. They sent it out to their email list, they posted it on social media, and they got all of their coalition allies to post about it as well. And in those posts, they urged people to contact their city council members because the posts are so cheap, right? Once you've distributed a communication broadly to the public and it's non-lobbying, you can use it later on for lobbying, and that won't change the underlying cost of it to be a lobbying expense. So what they did here is they distributed it broadly out to the public as a non-lobbying communication, and then later on, they used it for grassroots lobbying because they knew those emails were super cheap. It only took them 10 minutes to write the emails and social media posts and blast those out. But they were going to have a much higher return on investment, a higher engagement rate from that social media. Those were actually going to generate calls to those legislators. And here's an example from Massachusetts, where the Massachusetts Food Systems Alliance met with members of the state Senate and the state House to talk about the Healthy Incentives Program, which is a program that had passed the previous year, and they were coming to report on how the program was being implemented, and met with all these senators to talk about how many students in their districts were being served meals at school by this program. When you vote in the chat box here, is it lobbying or non-lobbying? And if it's lobbying, is it grassroots or direct lobbying to do these visits? And as a bonus here, see if you can figure out what's wrong with the picture. Or if you think we need more information, we're missing information, go ahead and ask that. Okay. Everyone's getting it on the lobbying. I'm really glad that you're getting that. That's great. This is a communication with a legislator, direct communication with a legislator, but they're not talking about legislation. They're talking about a bill that passed last year and giving an update on how well the program is going. Perfect. So it's a non-lobbying expense. It was expensive because they had to bus people in from around the state to get them to these meetings. And it's not an oregano plant. Thank you, Ariel. You're exactly right. It's a basil plant. But here's what I want you all to take away from this. State Senator Jim Welch was so excited about the plant that he kept it in his office. And Chris, you're right, it's a gift, but the Food Systems Alliance made sure that each of these basil plants was below the cost of the basil plant is below the gift threshold. It's a token item under Massachusetts law. It's not a reportable gift. He kept that basil plant on his windowsill, and then when it died, he went out and bought a new oregano plant to replace it and kept that oregano plant alive. And then later on in the year, when they came back to advocate for a specific increase in the budget for the following year's Healthy Incentives Program. So they came back in a lobbying visit later that year to ask for a specific amount in the budget. He had that oregano plant sitting on his windowsill and he proudly showed it off. And so what I want that story to leave with you is the importance of people feeling a connection to our issues. That if you can give them a basil or an oregano plant to feel connected, this was a farm and feeding program. Think about what it's going to be from your programs, from your issues. How do we get public health authority to have a story that lives on in people's minds? We need these legislators not to think about the academic side of what public health authority, what the definition is, but who are the people in your state who bring this alive, who can make a story that people are going to remember as they learn about this issue. What about on social media? Well, the rules on social media are exactly the same. Social media is a public communication. So if you have a call to action and refer to specific legislation, it's grassroots lobbying, and that's totally fine. So whether it says contact your legislator or whether you just tag your legislator, because tagging your legislator is providing that legislator's contact information on the social media platform. Either way, it's a call to action. So you have to treat the cost as grassroots lobbying, but that's okay. It's so super cheap to do social media and the engagement rate is going to be really high. It's a good investment for your non-lobbying dollar, for your lobbying dollars, right? Our point here isn't to say don't lobby. Our point is to make sure that we're doing our lobbying when it's strategic and effective, and we want to use non-lobbying grant funds when those non-lobbying grant funds can be stretched as far as possible. Any questions on those examples? Questions about, I know there had been a number of questions earlier about social media, so we can sort of weave those in as we go along. And just as I mentioned earlier, in the example with the op-ed, if you produce materials that are distributed broadly to the public and that reflect a view on specific legislation but don't have a call to action, they're non-lobbying, distribute them broadly to the public, and you can use them later on in lobby day. And this is a really important point, especially for folks in the public health ecosystem who aren't doing any lobbying. Think about how the reports that you produce that are non-lobbying communications, how can other people in the public health ecosystem use your materials later on for lobbying? Think about what reports and what fact sheets your coalition allies are going to need when they lobby on a bill. So maybe your organization doesn't do any lobbying at all, but your colleague organizations do. Think about what they need when they have a lobby day on an important bill, and then work your way back. So if they're going to have a lobby day in May about an important bill they're working on, in February, you should be thinking about what materials would be most effective to drive the community to support this bill, and produce those materials and get them out to clergy, get them out to editorial writers, get them out to talk radio producers and PTAs, get them as broadly circulated as you can to change the public conversation ahead of that legislative vote. And then your colleague organizations are going to have those materials available to them when they go to do a lobby day. Yeah, Mackenzie, I love that. That's a terrific idea. Okay, and the last point I wanted to make here is a question that came up a couple times, which was, what about testimony? And you can testify in front of a committee, and it's non-lobbying if you get a written invitation from the committee chair on behalf of the committee to testify. And so if you have one of these opportunities to testify, we all know it takes a long time to write and research testimony. So it would be nice to use non-lobbying dollars to testify on that bill. If you get one of these, it's like a Willy Wonka golden ticket. So if the committee chair sends you one of these Willy Wonka golden tickets, you can spend all of the time testifying, all the time researching your testimony and writing your testimony and saying why you support or oppose this bill. and it's all non-lobbying activity. So you can use foundation grant funds to pay for your testimony. The key is it has to be from the committee chair on behalf of the whole committee. It can't just be some crazy backbencher who supports your idea sending you the invitation. But even if the committee is held by someone who's hostile to your ideas, they'll generally issue one of these letters out of professional courtesy if one of your supporters asks them to. So it's a really powerful tool. If you ever have an opportunity, talk to Raya. I can help write one of these letters for you. And we can have, the letter that's on the screen here is one that I wrote for the Heart Association when Rachel Callanan was their lobbyist in Minnesota. I just wrote this. I emailed it to Rachel. She forwarded the email to the chief of staff of the committee. Committee chair cut and pasted my letter word for word onto committee letterhead and just mailed it right back to Rachel after having the committee chair sign it. So Rachel then used RWJF funds to prepare her testimony and to testify on it. So Clement asks, what about testifying on a bill where we don't say anything about the bill? That's kind of useless, right? And I'm being a little bit tongue-in-cheek, Clement, but the point of testifying isn't just to provide data. Legislators can get their own data. The value that we serve as public health experts is providing our expertise. And so if we're hiding the ball by trying to not reflect a view on legislation, the legislators wind up just finding that frustrating, right? Legislators want to know what you think about it. And so whatever opportunity we have to testify, it's useful to either get one of these Willy Wonka golden tickets or just code your time as lobbying rather than trying to dance around it by providing data, but don't without reflecting any kind of a view on it. That's just going to wind up being a sort of a frustrating exercise for everybody involved. So what other questions do folks have? I've got some examples I wanted to put up to see if the folks in the examples might have suggestions but before I do that, I wanted to answer any other questions that people have. So here we have an example from Montana. Here, and I don't know if Monica's on this call or not, but folks can guess in the chat box, does this look like a lobbying communication or non-lobbying communication to you all? And explain why it's lobbying or non-lobbying. Yeah, right. This looks like a communication, and I don't know because I wasn't in the meeting, obviously, but it looks like they're talking about big picture policy issues. They're not talking about any specific piece of legislation. So all of the costs for Monica's trip to DC could be paid for with non-lobbying grant funds because they're not talking about specific legislation. They're talking about importance of funding, and they're talking about ways that the senator could be valuable. But if they're not talking about specific dollar amounts in terms of funding, they're just talking it counts just as educational advocacy and not as lobbying. So you could pay for her flight, you could pay for her time, you could pay for her hotels in DC, all with non-lobbying funds, if that's the point there. Oops, sorry. So here we have the website of OPHA. And on their website, they list their policy agenda. They say specifically what their agenda is. They list a bunch of bills that they want to pass. And they say that they include, let's all zoom in here, get informed and get involved. They've got ways to get people engaged. You think this is lobbying Well, we got Mackenzie on the call. So Mackenzie, why don't you come off of mute? Give your rationale for why you guys paid for this with lobbying dollars and non-lobbying dollars.
Well, truthfully, it was created with volunteer hours, which we are actively working on. But we would think that this would be non-lobbying because it's not making an ask. It's general. Just get involved. People, if they want to take action on it, can do so. But we are not telling them to do so, nor with our opinion on how we think they should do so.
Right. So that adds an extra layer. So it's volunteer hours. So the organization didn't invest any money. So you could have included, you could have made it lobbying. But in this case, you really don't need to. You say get involved, email Mackenzie. And that way, I assume you collect all of the email and the contact information for the people who want to get involved. And then you can follow up with them with lobbying emails if you wanted, if they wanted to get involved and lobby on specific things.
Yes, and we do that otherwise, but not with this
Right.
one in particular. Yep,
Terrific.
exactly.
And you know, this not to be the shill for OPHA, but I really encourage all of you. I was on a whole bunch of different affiliate websites over the past few days. OPHA's is really good on the policy side of things. I think I was just like, I learned a lot about Oklahoma public policy legislation, public health legislation, just by going on your website. It was really robust. So but kudos to the folks in Oklahoma on that. Michael in Georgia says, so we can't ask for specific dollar amounts. You totally can ask for specific dollar amounts. Just recognize that that's lobbying. So what we need to do is look at the organization's budget. Look at, if you have revenue coming in from conference registrations, from individual donations, from all sorts of unrestricted funding sources, you can use those to pay for lobbying. The whole point here is that we want folks to be doing lobbying, but just make sure that you're tapping into unrestricted sources like conference registration fees or members, individual members fees. And those can pay for the staff time involved with the lobbying. And then go ahead and ask for specific dollar amounts, right? Ask for exactly what it is that you want. Some organizations probably dance around and say, we want as much funding as possible. And that's useful, but the legislator is not going to know if they're making you happy unless they know exactly how much funding. So by all means, go out there and ask for as much money as you want. Just code your time as lobbying when you do that. So here, I don't know if we've got folks from Utah on the phone, on the webinar, but here in the Deseret News, the Utah Public Health Association wrote a whole op-ed. They said why the Utah Public Health Association thinks racism is a public health crisis. It talked about a whole slew of issues, and then it says, the Utah Public Health Association wholeheartedly supports Representative Hollins's bill HJR 13. And so this is so similar to the Baltimore Sun op-ed. I'm not going to have us vote again. But I thought this was a terrific example of a public health association using non-lobbying funds to advocate for legislation publicly, right? This is another example. They did not have a call to action because no one reading the Deseret News is going to call their legislator just because it says at the end of this op-ed, so call your legislator at 801-555-1212, right? No, but if you've made a persuasive enough argument, hopefully some people will pick up the phone or send an email to their legislator. And more importantly, I hope that the Utah Public Health Association blasted out this op-ed to all their members and encourage them to encourage the members to contact their legislators about this joint resolution 13. And the last one was from Georgia. So here we have folks from, at their conference, at their annual conference, they have a talk radio station broadcasting live from their conference, and they just have a whole lot of public health people every day on talk radio broadcasting live from the conference. Would they have to treat this time as lobbying or non-lobbying dollars, and pay for a portion of their conference with lobbying or non-lobbying dollars for this? What do you guys think? And why are my, in what situations would they have to pay for it? Yeah, so Donna says it depends on what they're discussing and if there's an ask. And for the most part, if you're on talk radio, you're probably not going to be saying, so call your legislator, because no one's actually going to call their legislator. But it's a great opportunity. Talk radio is always looking for time to fill. And it's a terrific opportunity to talk about legislation, because often legislators are listening to talk radio to try to get a pulse on their constituencies and get a pulse on what the community is talking about. And so I love the idea of inviting a talk radio station into your conference to elevate public health, right? The most important thing we can do for advocacy is get people talking about public health issues. The more that we can expose the public to public health, the better we're going to do on advocacy. So I thought this was terrific. Anyone from Georgia on the call? Oh, Michael, you're even on my screen. Why don't I'm curious to know, is this a tradition that you guys always do? And how did you guys get the talk radio, get Talk 92.1 to start coming to the conference? Oh, you're on mute, Mike.
I've just been a member of APHA for about 8 months now. I've never been a part of this yet, but I know Jimmy, and I'm going to email him right now. So
please do. I'm going to use this in all my examples, because the most important thing that we can do here is elevate public health. I think that talking to a legislator is hugely important, but introducing them to what we have to say is just terrific. So yeah, the more affiliates that can do this at your own conferences, the better. I think this is this just gave me a lot of excitement and a lot of hope for public health when I saw this.
Hey, this is Scott Maxwell from Georgia, and I did participate in the radio program during that convention. And basically, my role was giving them a review of what had passed during the previous legislative session. So it was no call for action, but it was a discussion. These are the issues, these passed, these did not, these were amended, that type of thing.
And legislators will know, hey, people are paying attention to public health. I better vote for public health. I better vote for the communities in my constituencies if it's going to show up on this. That's terrific. I'm really excited about this. Looks like we're nearing the end of our time. I'm curious to know other questions folks have, other tactics that they want to share of ways that they've engaged their communities to push for public health. Well, if you have other ideas, you can always, after the call, email them to Raya, and we will share those out with folks. We're going to send around advocacy resources. Raya's posted it in the chat. Anything else you want to say? Oh, Michael's got his hand up. Yep.
I just want to say I'm so encouraged by this. I work full-time for a 501c3 and was always had my wrist slapped. But, during COVID, when they passed home delivery alcohol laws, and the prevention world that I work in was just caught totally unaware, it gave me the why. I was so upset. It gave me the why to figure out, I'm going to figure out how to lobby. And that's your approach, Alan. And I'm strengthened by that. We need that. And that's like me doing push-ups in the background hearing you talk.
Excellent. Oh, that makes me happy. Well, with that, everyone can go off and have a great weekend and think about ways to incorporate advocacy into your next, into everything you guys do and into your next conference.
Awesome. Thank you so much, Alan. Thank you for your time. And thanks everybody for joining us.